What we do here matters, because what we don't do matters even more.
We need to continue to push, and we at ADAO are going to continue to push the Surgeon General of the United States.
As you know, the United States continues to use asbestos, and that indeed is a barrier to others stopping its use.
The most horrific part of this whole story is that it is preventable.
State your name, please, where you're from.
Tom Abatal, the environmentalist, the Environmental Institute. Very simple question for Dr. Black. PALS, the acronym. Would you explain what PALS? The acronym. PALS?
We actually had several ongoing grants, and we had to modify our grant. Oh, there we go. Yeah. So we had to modify our grants a bit. We had 2 studies going on childhood exposure, and so anyway, we had to redefine this study. So anyway, it's pre-adolescent latency, yeah, and or pre-adult. I'm telling you, adolescent, pre-adult. In other words, we wanted to get childhood exposure all the way up to age 20 in the female and age 22 in the male, and so it'd be pre-adult latency study.
I have a question for Dr. Oliver. You didn't get to finish your presentation. You were touching on something that was really important about screening for mesothelioma and oxycontin and some of the other hopeful biomarkers that we're looking forward to. We took a group to the Capitol, 35 people. We had 6 young women as patients. Can you touch on what you're seeing in the research lab for early screening for mesothelioma that might be encouraging to our audience and online audience as well?
Well, and I apologize for poor timing or something, but one of the things the only thing about malignant mesothelioma in terms of clinical presentation is its unpredictability. And it often occurs very suddenly with no warning, so that chest x-ray screening or CT screening really is a waste of everybody's time. So what's been looked at are biomarkers in the serum to look and see if you can do blood testing and screen for malignant mesothelioma that way. And 2 of the biomarkers that have been looked at most carefully probably, and there are others, are serum mesothelin-related protein, or SMRP, and osteopontin. And there are a number of epidemiologic studies that have been done looking at SMRP as a screening test. One is being carried out by the Dust Diseases Board in Australia. And those studies to date have not shown any benefit from the use of SMRP as a screening tool. What both SMRP and osteopontin may be useful for is following individuals who have been diagnosed with malignant mesothelioma when you're concerned about recurrence. So it appears that they may be useful in following someone in whom the diagnosis has already been made, but not in following populations as to screen for the development of malignant mesothelioma. Harvey Pass and others have looked at osteopontin, and what they found with regard to osteopontin was that there are increased levels in people who have malignant mesothelioma compared to asbestos-exposed individuals who have non-malignant disease compared to individuals who have no asbestos exposure. They've also found correlations, no correlation between exposure status and osteopontin, that is, exposed, not exposed, age or gender, but duration of asbestos exposure appears to correlate with osteopontin concentration, it being higher in those with 10 or more years of exposure. It's also higher in individuals who have asbestosis and pleural plaques, but not in those who have normal chest x-rays or plaques or asbestosis alone. But neither has been shown to be effective as a screening tool, and there are a couple of articles that have come out this year that seem to reaffirm that. Studies are ongoing, and investigators are looking at other biomarkers as potential screening tools, but so far nothing has been identified that is useful as a screening tool for malignant mesothelioma. So right now, I think the consensus is that there is no effective way to screen populations for malignant mesothelioma, which is different than following an individual in your clinic. And just one more comment, that is, if osteopontin concentration is elevated, it's also expressed by other cancers, like lung cancer, ovarian, and pancreatic. So in those individuals at risk for malignant mesothelioma who have elevated osteopontin levels and no malignant mesothelioma, they should be followed continue to be followed for malignant mesothelioma, but also worked up for these other cancers.
Are there other questions? Yes, sir. Can you bring the mic, Linda?
We're going to take John's question, one more, and then we're going to break for a very brief coffee break.
John Carter from Australia. I'm particularly interested in PAL. I do a lot of training and presentations. I find the most powerful tool to get people in contracts to listen is the effect on their children. I'd like to see some information on that and ask the question, have you got a study in America on people working on building and low dose exposures, and plumbers, carpenters, electricians, cutting and drilling asbestos?
Do you want to take that, Arthur?
There are not a lot of studies on low-dose exposure, but there are some. There are some specifically on family members. That's actually not a new area. When Christopher Wagner reported on the outbreak or the many cases he saw in a short period in South Africa and reported on that in 1960, some of those were in family members. In London, the paper in '65 showed that there were a fair number of cases in family members. And then the group at Mount Sinai, Henry Anderson is the lead author on some of those papers, again showed that family members are at risk. And again, I'm sure all of us who have done clinical work have seen situations where what we would consider to be low-dose exposure has given rise to disease. The Unarco plant in Patterson that Dr. Solikoff studied, there's a paper that reports that individuals who moved into a particular home, a house, where a worker had worked but was no longer bringing asbestos home, that even 15% of people who moved in after the worker's exposure ceased ended up with evidence of asbestosis on x-ray. So there are these various studies, but in terms of the trades, you really can't find trades with what we would consider true low-dose exposure. So it's these household exposures, neighborhood exposures, and there's a fair amount of evidence. So if you need that to convince your colleagues, even data both from animals and humans, that one day of exposure has been sufficient to cause mesothelioma and lung cancer.
To address that, there are some papers. They're not from the United States. There's a paper, Awatsabutu from France, that's looked at trades, different trades, and shown through subjective measurement, not through actual measurement, but through industrial hygienists estimating what the risk, what the concentrations were, and showing that even down to 0.1 and concentrations at the level where our standard in the United States and other countries are at right now, that disease is still occurring, that mesothelioma still occurs. And he does array it by occupation. I think the occupation that had the most number of people in one occupation were mechanics, I believe. And then there's another paper out of Germany that Rotospieler and others have written that look at low level by some trades. But there's very limited on this, and I guess Linda is anxious to get this over with. So we'll take a coffee break.
One more question. Dr. Millett has one question.
Jim Millett, MBA Scientific Consultants. I think this is, Duke, you may be able to answer this about the trends of mesothelioma. Are we at the peak of mesothelioma cases in the United States, or do you think there's time in which we'll see that?
I think in the United States that we're probably starting to level off at this point in time and starting to go down. I think what we're seeing is a change in the type of people that get mesothelioma. We're seeing more women getting mesothelioma today. And so the epidemic in the United States, and you'll see in this paper, is sort of leveling off and going down. That's not true in the developing countries. We're going to see this, if we continue exporting, this occurring. But in Europe, United States, Australia, I think you see a trend leveling off on mesothelioma at this point in time. Correct me if I'm wrong.
Could I? Jim, the only other comment to make about that is I would agree with Dick that in the traditional groups that we think of, insulators, construction workers, it's probably going down, but we're seeing more in other settings. The other countervailing trend that nobody sort of figured in, if you look at Nicholson's papers, for example, that predicted through 2020 or 2030 the rates, is people are living longer now. We're having many more people living into their 70s, 80s, and 90s. And because of the long latency you can see, we are starting to see more and more cases of mesothelioma in 80-year-olds and 90-year-olds. So I think the only place that we know definitely where things have improved and where the curve has turned downward has been, for example, in Sweden, where they banned asbestos 30 years ago, and the curve is now coming down. But it's probably either plateauing or may still go up a bit in this country because of these varying factors.